Hello, ladies and gentlemen. Welcome back to yet another episode of the BTP podcast. I'm here joined today by my good friend and colleague, Tyler Martin. He is okay. Why don't I hand it over to him to tell you guys about himself? Hey, Tyler, how are you?
Hey, I'm good. How are you?
Very good, very good.
Thank you for having me on the podcast. I've
Of
always wanted to be
course.
on a podcast, so this is a lot of fun.
Oh, thank you for being here. It's a
hmm
pleasure to
hmm
to be talking to you. Now, okay, so why don't you tell us a little bit about yourself? What do you do? What are your likes and dislikes in this
Yeah.
crazy world?
Okay. A little bit about me. I'm doing physical and mathematical specialist at UTSC with you. We're in a lot of the same classes, and some of my dislikes. COVID right now is a big dislike for me. So,
Right. Yeah.
and yeah. But I
I,
love physics and math. That's my go-to. Yeah.
no, it's great stuff. I do agree with you in in that sense. We share the love of physics and math. I don't know if you remember Imad. He was on the podcast a while back.
hmm
Um, now we got you, and hopefully a bunch of other people join in the cohort. But
hmm
yeah, today actually we're going to talk about something very relatively timely to all of the COVID stuff, and so you have done some research and studies on, mathematical modeling, which I think I guess people are getting tired of hearing it, and it's surprising because now politicians are talking about it, right? Like,
Yeah,
oh,
yeah,
these are the numbers in mathematical models. Based on these, we're making these decisions. It's never you could never get politicians to pay so much attention to science, I suppose, as you do now. Um,
yeah.
so now all of that is about the spread mostly. That's what they were talking about. But all of that
hmm
also applies to vaccination strategies, which is probably the most timely because those are the decisions that politicians and then the world leaders around the world are making decisions on, right? All
hmm
of these
hmm
numbers that are jumped out. So now for the audience, we're trying today, with the help of Tyler, to make sense of all of this. What are these, modelings that they talk about? What is it
Yeah.
behind the scene? And to simplify it to a degree, basically. So why don't you go ahead and like start us off with what was the starting point of your research early on, and what were your thoughts going into it, and immediately after you started reading some papers and articles.
Yeah, definitely. So first, like you watch the news and you see all these politicians, like you said, talking about mathematical modeling, and then you go, what is even mathematical modeling in the first place? So then you have to do a little bit of research of when it first started. First off, we haven't even done a ton of research in mathematical modeling. It only started around like going up around 40 years ago.
Wow.
And recently, uh, there's two big definitions of mathematical modeling we can use today. One is the deterministic and the stochastic. Those are big fancy words, but they pretty much mean stochastic as in randomness. So we can capture the randomness of humans because no one can actually predict human behavior or human psychology. Deterministic is a little less complex. It just kind of puts humans as a person with no emotion, no thoughts of what they're going to do. They're just there. And then we can judge how a disease reacts from these two different types of models.
Right.
Yeah.
Right. And do you know, so I mean that's a natural, we're going to delve into what they are in a second, maybe
Mm-hmm.
in further depth, but do you know what are the when people talk about these modelings, is it mainly stochastic or the deterministic, or sometimes this, sometimes that, or a combination of both? What are they usually talking about? Or what are the most
Uh,
effective, perhaps? I don't know.
the most effective, from my point of view, from what I found, is stochastic modeling is most effective.
Mhm.
Although it's more complex, meaning we have to have big fancy computers to run all our simulations.
Mhm.
It's more effective in actually grasping our results and accurate results
Mhm.
when you compare it to deterministic modeling. Um, I would say For deterministic modeling, it's more better for hand and paper. So if you want to do a model by hand and paper like we all do in class, then that's a good way. But stochastic modeling is definitely the way to go when
Right.
you have the time. Yeah.
Right. So the deterministic model doesn't take into account, just to clarify, right? It doesn't take into account human behavior. So for example, if you're supposed to be social distancing, you're social distance, that's an absolute state. Like it doesn't consider that, if you're in a lockdown, you're going into grocery and you might happen to remove your mask to unlock your phone. So none of these is accounted for. I mean, I guess it's not specifically accounted for in this stochastic model either.
Yeah,
That you take,
exactly.
but it basically treats it as an absolute state, meaning that it's everything being perfect. Is it? Well, I guess it depends on the assumptions you make too, right? You can also make the
Yes.
assumption that, right? So
Yeah.
but whatever assumption you make is a fixed one in the what do you call it? The deterministic modeling, right?
Yeah, everything is fixed. For the stochastic model, we actually have a probability.
Right.
So like if you're more probable to go outside or if you're more probable to stay inside. So it's not like you're fixed to do one certain thing. We have a
Right.
probability density. Yeah.
Right. So instead of being 0 or 1, it's somewhere between 0 and 1, and it's
Exactly. Yeah.
potentially. And are those models, like the stochastic ones, are these probabilities dynamic, maybe changing in time?
Yeah,
Okay.
for sure. They change in time because people's reactions to a pandemic changes with time as well. So, like we saw when the pandemic first started, a lot of people were outside and about, not really caring. But as soon as the stay-at-home orders and stuff came along and the lockdowns, then we had to stay inside. So then our
Right.
model has to account for that as well.
Right.
Yeah.
No, that's fair. Is there anything specific you want to talk about in either of the two in their technicality? So what are the factors that we're looking at when we're saying probability of, for example, you mentioned human behavior, but what other factors are relevant here?
Because actually, it depends on how complex you want to make your model. So
Okay.
if you want to make a super complex model, then you could take in a ton of factors, like not only just human behavior, but like traveling around the world and which planes travel to which countries and which are bringing back stuff. Or another common thing is for Western societies, we like to shake hands.
Mm-hmm.
And so for other societies, we don't have that type of contact.
Mm-hmm.
Like in Asian societies, it's normal to bow.
Right.
So just like even the smallest things, just like that, you can take into account into our model.
Mm-hmm.
And but as the more you take into account, the more complex it gets. So it's kind of like a trade-off. Yeah.
Right. Right. Yeah, and then you did mention the we'll get to vaccines soon enough, I suppose, but you did mention like it really depends. So these models all start with some sort of assumption, right?
Mhm.
Because and that assumption determines what the so let me take actually a couple of steps back for people who are not maybe thinking about. So the idea is that you want to model, meaning try to predict what will happen given a certain guesses. Like, so you say, okay, if there's no lockdowns, right?
Mhm.
And correct me if I'm wrong here, or if I'm slightly off, or you can add a
Yeah.
caveat to it. But the idea is that if we make certain assumptions, meaning, for example, there's no lockdowns, everybody's behaving like they would, there's no pandemic at all, right? What are the numbers are going to look like? What are the number of people who are getting sick or who are dying? What demographics? What geographical neighborhoods, perhaps in the country, in
Mhm.
the city, etc. And based on that, and then you combine, and then you create different models with different set of assumptions, and find out what you want to do depending on what you want to achieve. So, for example, so one is that absolutely no restrictions at all. One with minimal restrictions, maybe just social distancing and mask, but then do whatever you want.
Mhm.
Or maybe 20% capacity restaurants, whatever, or absolute lockdown. So you create certain assumptions, you take certain assumptions and you model these, and you try to see into the future essentially, and then politicians come up and based on those predictions, if you will, make certain decisions about what to do, what restrictions they want to impose on the population and whatnot. Is that a fair summary of what is the point of these modelings in the first place?
Yeah, yeah, that was a great summary. And a big point is the relationship between the politicians and the scientific researchers.
Mm-hmm.
So if they don't have a good relationship and they're not constantly communicating over
Right.
what they're finding from these models, then the politicians will have a harder time making decisions on health policy
Right.
issues, right? So you have to have that constant communication going back and forth so you can make those good decisions.
Exactly. Now that's a very, very fair point, actually. And so now I said all of this to clarify all of this, but the beef I have with these modelings at some point, not all the time, but first of all, they're not the so this is the idea that some people talk about. Actually, my dad always talks about this. Is like the carpenter only cares about the wood, or the shoemaker cares about his shoes, and the electrician cares about his wires. At the end of the day, when you're talking to somebody whose job is to save lives, the only thing they're going to care about is to save lives. And
Yeah,
the save lives doesn't comprehensively take into account everything. It just takes into account saving lives who are being lost due to COVID, period.
yeah,
Like if it, I mean, I'm not saying that those people are actually thinking like this, but that's their priority because that's their job. And the same way my job is, I don't know what it is, but right now it's to talk. So all I'm going to focus on is talking, right?
yeah.
So my point is that, okay, all these modelings are good and done. I guess supposedly the politician's job is to take into account all of these modelings from the the scientific community, from the health community first in the first place, and then similar modelings are going to be done, slightly different obviously, but similar mathematical modelings are going to be done on the economical side by the economists, or what are the impacts are going to be based on different assumptions again to the economy, and then eventually politicians going to be a general person taking all of these into account. That's at least the idea. And then make some decisions. Anyways, let's back up. So the beef that I have is that there is no caveat by when you talk to me and you know it, the scientists know it, but when you're communicating this to the public, there's no caveat that all of these modelings, though they predict into the future, they highly depend on your assumptions. And as you mentioned, ultimately they're completely probabilistic. Like some of these modelings I have seen specifically restricted to Ontario, where we are in Canada. So and some of these don't take into account at all that there are in fact travelers coming from different countries, and I'm not saying they shouldn't, right? And their only variable is human behavior due to lockdowns or restrictions or whatnot. And sure, that changes the numbers, but let's toy around with no travels whatsoever. Or where are these outbreaks actually coming from? Is it because of travelers, or is it not? Or is it because people are going to restaurant, or is it not? So I think this is very lost, and it portrays outside to the public so much that these are God-given things, which they're not. I think. And would you agree with that? They're very, very varying depending on your assumptions.
Definitely. Assumptions is like probably one of the biggest things. Like you can have a model that is almost exactly the same, but if you vary one thing, they can go completely different directions. Like you can be off by, if you're calculating the number of deaths, you can be off by quite a lot. So our underlying assumptions of our model are particularly important, that we make accurate assumptions from what we actually perceive in the world.
Perfect. Now I just wanted to clarify, make sure that I'm on track there. I'm not just spewing nonsense out there. Now, obviously, now the more interesting subject today has become the vaccination and vaccination strategies. How you vaccinate, when to vaccinate, which population to vaccinate, which geographical location to vaccinate, etc. So all of these are very good questions. And again, similar modelings are being done. And I know you were talking about, before we started this conversation live recorded, you were talking about this New York Times article, which was looking at different vaccination strategies. And essentially they were trying, so this is the title of the article, if let me read it out. When could the United States reach herd immunity? Well, question mark, and the answer is it's complicated, and they answer this. So first of all, well, let's define herd immunity. What is herd immunity for those who don't know it?
Okay, I have to define one more thing before
Sure.
I define herd immunity.
Okay, fair enough.
So first, there's a reproduction number. So a reproduction number basically just says, if I have the virus, how many people on average would I pass the virus on to? So say I have a reproduction number of 2, that means me having the virus, on average, I pass it on to 2 more people. So a herd immunity says that our reproduction number is less than 1. So when we have less than 1, then there's no chance of an outbreak or an epidemic happening. And this means that there's less risk of the situation getting more serious. So herd immunity basically just says, wait, let me get a good definition, that the state of the population where the fraction protected is sufficient to prevent outbreaks. And so herd immunity kind of just is basically what we want to reach from vaccination efforts. Yeah.
Right. Vaccination, and the fact that some people already got and then recovered, right? And supposedly they can't get reinfected.
Exactly. So there's we have to take into account a removed population when we're doing these. The removed population is basically people who've gotten it and can't get it again, or people who have tragically passed away from it, or people who have immunity to it. COVID, we don't know if there's any immunity to it yet, like underlying immunity, but there are other diseases with immunities.
Right, exactly. So then that because there's a certain portion of the population, whatever that number may be, that is removed, then the R naught, which is the reproductive number, drops below 1, which ends up over time, this virus decays because it cannot. So if I get it, if my R naught is 1, means that if the average means that if I get it, I can only give it to 1 more person. So I'm only replacing myself. I'm not growing. And if it's less than 1 on average, it means that I'm not even replacing myself. So over time, this is going to vanish. That's right? Okay.
Exactly.
So,
yeah.
Right. So in that sense, a combination of these, whether you're vaccinated and you're immune, or so if I got it and I come to contact with you, and assuming you're vaccinated, then you can't possibly get it. Whereas if you were not vaccinated, I would give it to you, and my R naught would be at least +1 because you're not, you are not vaccinated. You're not immune.
Yeah.
Now that not being immune or whatever, so either that person is passed, so it doesn't even exist to, contract it, or they already got it, so they have immunity because they cannot be reinfected, at least for a period of time. We don't know what the period of time is exactly, but let's just say for now, for the purpose of this argument, let's just say it's indefinite. And or that person is vaccinated. Again, same idea. Now let's go back to the article, I suppose, and you can take the reins from there, but I'm going to reiterate the question. So the researchers were trying to see when the United States reaches this herd immunity, meaning that the reproductive number will be less than 1, so eventually the virus will die out over a period of time, and it definitely cannot grow. And their conclusion in one sentence was it's complicated. So why did they say that, and what were they looking at, what they find, what happened? Go ahead.
Yeah, it is actually very complicated. I think as a Canadian too, looking at what the States is doing is definitely beneficial for us, because we don't vary a ton from them. Some of the states have a lot more relaxed laws, as in like they can walk around without masks and stuff, but we're actually fairly the same. So just looking at this is very interesting. One thing they wanted to look at was if they sped up the rate of vaccination. So on average, the US is administering about 1.7 vaccination shots a day. So if they continue to do this, they would reach herd immunity by July, and around 100,000 people would pass. However, if they sped it up, it would increase to around 13 million shots per day. Then they reach herd immunity by May, and 90,000 people would pass. And if they increased it even more, which is very improbable, to 5 million a day, that's kind of insane, they would reach herd immunity by April, and 80,000 people would pass. I think the more interesting part of this article is looking how herd immunity and vaccination, along with relaxing social distancing measures, comes into effect.
Mm-hmm.
So if you actually keep 1.7 million shots per day, and then look at relaxing your social distancing measures, they will reach herd immunity by July. Like I said before, 100,000 people would pass. But if you lift restrictions when 15% of the population is vaccinated, then you reach herd immunity by June, so a little earlier than July, and 170,000 people would pass. So that's a big jump from 100,000. And then even more interesting, if they end all restrictions right now, then they'd reach herd immunity by May. But in that case, 320,000 people would pass. So these jumps to me are just like insane when you look at how many people would pass if you just relax the restrictions on social distancing.
Right, and yeah, that is insane. Like, and the same thing we were talking about. The initial assumptions can change a lot, and the same thing happens in the vaccination strategies and social distance. So I think so. I don't know if I got it right. So currently with the with what do you call it? The current rate of vaccination, and if we keep the measures in place, like the social distancing, at least the basic measures, such as the social distancing and the masks.
Yeah.
Now that number of death in the United States until the herd immunity is achieved is 100,000 people.
Yeah.
Right. So let's take this again. So if the same rate of giving vaccine to the U.S. population is continued, not increased, not decreased, which is 1.7 million per day, which is impressive, by the way.
Is a lot,
though they have a big population too.
Yeah.
Bigger than Canada, I mean. So anyways, so 1.7 million per day until the next foreseeable future, like in this next few months. And then you still do social distancing, you still do wear masks, maybe no major parties or anything. And then the estimated number of deaths from COVID until July, which is the time that they reach herd immunity, is 100,000. But if they don't if they ease up the measures, meaning don't wear masks, maybe don't social distance, maybe throw away some parties, but not a lot, then that number jumps by almost twice, 170,000 all of a sudden, which is and now let's say we keep the social distancing measures, and hold on a second, let me see if I get this article right. Excuse me. Now, if you do increase the supply to 3 million a day, but then they didn't do any investigation as to what happens if you do measures or don't do measures. Did they? No. If you increase the supply but also keep the measures.
Oh no, they didn't. They just
didn't do that. Oh, okay. Okay. They didn't do that. Okay, but it is very interesting. And okay, but if they do increase however, if they do almost double the shots, although they reach herd immunity much sooner, still number of deaths is like 10,000 people less, from 100 to 90,000. That doesn't make a lot of sense. How's that? Do you know?
I'm not too sure. That would also depend on what we were talking about before, their underlying assumptions.
Right, right.
So,
And they
um,
didn't talk about those assumptions, I suppose, right? In the
yeah,
article.
yes, they do.
Oh, they do?
They
Okay.
put it in the beginning a little bit, but not a lot,
Okay. Long,
because
long, long.
it's yeah. They also do cover the different types of variants, which is
Oh,
very
okay.
interesting. So, with the current variant, like I said before, 100,000 by July.
Hmm.
So 100,000 people would pass and they'd reach herd immunity by July.
Hmm.
But for the more contagion, like very more contagious variants, with precautions, uh, and the states gets all of those variants, they would have around 200,000 people pass,
Hmm.
and they'd reach herd immunity by July.
Wow.
But if they have the most contagious variants with no precautions at all, they would reach an insane number of 530,000 people would pass, and they'd
Wow.
reach herd immunity by April. So
Wow. So
that,
more number of people in short amount of time, basically.
exactly.
More, oh,
It's
wow.
Yeah, it's quite a number to look at. The death toll at that point would be just insane.
So in a way, the immunity due to getting the virus and recovering from it is actually acting much faster than the vaccination process, basically. So that's why they're getting to the herd immunity earlier, because the virus is infecting everybody, and whoever survives just is immune. So the immunity increases fast,
Mhm.
but obviously a lot of people are going
Yeah,
to
it's at a big
die.
cost. Yeah.
Yeah. Well, but that is like these numbers that is looking at these numbers is actually quite we will, by the way, I should say this, we will put a link to this article in the show notes, so if anybody wants to go and look at these numbers themselves, feel free to do so. Okay, let's now move forward, unless you want to talk about this article more. I don't know if there's anything left. No, okay.
No. Yeah.
Okay. So let's move forward a little bit and talk about what are the discussed around the table, if you will, the different strategies of vaccinations, and what is the argument for each of them in terms of who to vaccinate, which areas to vaccinate, why and why not, etc.
Yeah, there's a couple different methods of vaccination. One very promising one is called a focused method of vaccination.
Mhm.
That's where you focus in on a certain group of people, give them all the vaccination that we have, and then once they're are not basically is getting better, then you move out to a little more like diverse, further out rural areas and start
Mhm.
vaccinating there.
Oh, so it's
So
mostly thinking geographically, right? If
yes,
you're
yeah,
if you're in a big
exactly.
if you're in a big congested populated city, for example, let's say
Hmm.
Toronto, New York, whatever, then you focus on that
Hmm.
and leave the rest of the state and the province alone, right? That's the idea.
Yeah, yeah.
Okay, yeah, go ahead.
And so like that strategy is actually one of the more promising strategies.
Mhm.
So we actually, as Canadians, we see this happening now. Nova Scotia is giving up some of their vaccination to
Mhm.
other places in Canada so that we can actually get to a herd immunity for Canadians as a whole faster.
Mhm.
Yeah.
Interesting. And do you know, is now across Canada one story, but within Ontario, do you know if they're using this strategy or not? Like the focus
I'm
strategy?
I'm not too sure. From what I know, it's more of just everyone gets it, or the most important people get it first, as in the people um,
Doctors and
who are, yeah, doctors, frontline workers, or
mm,
people who need it, like the elderly who need it.
mm,
So people like that would get it first. So it's more, they're not focusing on a particular area. They're just trying to
mm.
get the people who are, ooh, I can't think of the word.
More vulnerable, maybe?
Exactly, more
Right,
vulnerable. Yeah.
right. Yeah. Look, I get I think the doctors and nurses is a bit clear to me, because we want them to be healthy to take care of all of us, not just for COVID, for everything, really. So
Mhm,
that's
yeah.
even from a very selfish point of view, not acknowledging their sacrifices. Completely selfish point of view, you still want them to get it first, I think.
Mhm,
The
mhm,
frontline workers, especially doctors and nurses, and the rest of the frontline workers, perhaps to paramedics, police officers, etc. So
Yeah.
those are, because those are very important. Like they have to be able to function, and at the same time, like very urgently be able to function. And at the same time, they're much higher at much higher risk. So that I think makes complete sense. But after that, although elderly are most vulnerable, but they're not mixing as much. I'm not so convinced that the focus after that, prioritizing those people, the focus approach will not be more successful. But they still also, by the way, so they still do these similar modelings, taking different assumptions, right? For example, assuming that you give it to elderly, and assuming that you give it to like a focus strategy to give it to parts of the population that are mixing and mingling more. Maybe they're denser neighborhoods, for example, basically the places that have the highest numbers, geographical places, right? So get them, as soon as they get contained, they can't really move it on either, right? As much. What do you think on that? What are your thoughts personally, based on the things that you're seeing?
I think mathematical modeling wise, it's a better way to get down the death toll to vaccinate the elderly first. Like if you think about it, our death toll will go down if we vaccinate the elderly first compared to everyone else, because the elderly are dying the most.
Sure.
So if you're just looking at it from a mathematical modeling point of view, it's like if we want to get down the death toll, vaccinate the elderly.
Right.
In general, though, I'm not too sure. I would say the focus strategy is probably the better strategy to go to, but after the frontline workers get their vaccination, I don't know. I'm not too sure who should get it after that. I'm really not.
It's a very complicated story, obviously. Yeah.
And you don't want to step on people's feet by saying, "Now you shouldn't get vaccinated." Right. So yeah.
No, I mean, I'm definitely not saying that I think focus is the right way to go. I'm just saying it's not really clear which one is. And maybe there is no one right answer or one wrong answer. Maybe both answers are wrong or both of them right. So it's just a slightly better. I think they're actually, at the end of the day, in the long margins of things, depending on what you're looking at. Yeah, sure. Maybe if you're purely looking at death tolls due to COVID specific, because on the other hand, look, there have been reports and studies done on the side effects of this whole COVID thing, like not just the deaths and despair from the COVID, but also the loss of job, economic distress, suicide rates, people who couldn't get their scans and for cancer, etc., their operations. And all of that is obviously costly as well, and we cannot just ignore that. Although the forefront is the COVID disaster, but it has a side effect that is rippling through our societies and communities as well, right? So we definitely would like to, if we do like to look at it comprehensively, I think at the end of the day that the approaches are not really clear cut. And that is what you were mentioning, like in terms of if you want to introduce more variables, it just keeps getting more complicated.
Exactly, yeah.
And perhaps even impossible to predict anything with any good measure of accuracy. So yeah, I guess the bottom line is it's very complicated. It's not as easy as this is the right way to go. So maybe we can relinquish that arrogance, I suppose, to a degree, because it is a complicated problem. So yeah, is there anything we left on the vaccination front that you wanted to talk about that we didn't?
I think we pretty much covered it all. By no means am I also a vaccination expert.
No, of course. No, we're just discussing our own, experience with these articles and whatnot. Yeah. No, it's good, because I think to a high degree, because you actually did study these matters to a degree. I mean, again, we're not claiming that we're experts, neither of us, but because you have done specifically the mathematical modeling, I'm sure you have more understanding than many, including myself. So it's good to, we don't need to listen to the greatest experts and increase our knowledge. I think it doesn't. That's as long as you know more than me, I can learn from you. That's it.
Yeah, yeah, exactly.
Right. Okay. Yeah. So I think it's a good place to stop. Like end our conversation. I'm
Hmm.
going to give you a few moments after this to, gather your thoughts, final words, if you want to say. But before that, I think it's a good point. I think this was a good good understand. I think you had this epiphany, I suppose, and I definitely did, that it is in fact a complicated matter. It's not
Hmm.
as easy as 1, 2, 3, go.
Hmm.
It's a bit, it requires in-depth contemplation, and at the end of the day, there are going to be mistakes, there are going to be errors, there are going to be things that are not going to get to the right answer, or what is even the right answer, right? So
Hmm.
all of these are subject to a lot of assumptions, and I think that was the most important epiphany of all in this journey today.
Exactly.
Um,
Yeah.
do you have any final thoughts that you want to add to it of
Um,
your own?
Maybe one last thought, and that
Sure.
is that no mathematical model can accurately predict the future.
Right.
Like no matter what, if we take in the as many complex variables as we can, we can't
Right.
predict the exact amount of people who will die. So
Yeah.
take everything these politicians say about mathematical modeling with a grain of salt when they're
Right.
saying it, but some of them are actually fairly accurate at the
Yeah.
same time.
Yeah.
So yeah. Mhm.
They're the best worst thing we have.
Exactly.
Okay.
Exactly.
Right. Fair enough. Okay. Thanks, Tyler. It was a
Thank
pleasure
you.
talking to you today.
Yeah, it was a pleasure. Thank you so much for having me on.
No problem. And thank you all for tuning in and listening to yet another episode. And I hope you enjoyed it. Leave your comments, suggestions, questions below. There's going to be the show notes, as I mentioned, which we're going to include the New York Times article in it. And until later episode, have a good one. Take care.